The pregnancy, postpartum, and early motherhood periods of a woman's life are mentally, emotionally, and physically transformational. Support during this time is crucial, but too often mothers are not fully supported in the healthcare system. But not being taken care of during and after pregnancy and birth can have lifelong impacts, which means we as mothers need to know how to best advocate for ourselves to make sure that we are getting the care that we need and deserve. Dr. Phoebe Ajayi is here to help us learn to do just that. Dr. Phoebe is a National Health Services general practitioner in the UK who desires that all women are well supported during and after pregnancy. While much of her work is focused on education within the healthcare system, today we will be discussing how we as individuals can take an active role in our own postpartum recovery, no matter how far out from birth you are. Welcome to Worthy Mother Podcast. I'm your host, Emily Hardy, a mom of two on a mission to help moms everywhere feel less alone. This is not a parenting podcast. Instead, it's a space for pushing back against societal expectations of perfection and embracing self-compassion in your motherhood journey. Let's get into it. Dr. Phoebe, welcome to Worthy Mother Podcast. I'm so happy to have you here. This is such a crucial conversation we're having. And again, I think something that for any mom, regardless of whether you are in a pregnancy or near postpartum period or years out. I know something in my own life. I've been kind of dealing with some postpartum recovery. My son just turned 4 and I'm finally getting around to dealing with some things and being referred to a pelvic floor physical therapist and things like that. So I think this conversation is so needed. Can you go ahead and just share a bit about yourself and maybe even your journey, what led you to focusing on postpartum rehabilitation and maternal health?
Yeah, thank you so much, Emily. I'm so grateful to be here. I'm so honored that you considered me worthy to be a guest on your podcast. Thank you so much for the opportunity. So, like you said, I'm Dr. Ajayi. I've been a doctor for about 1.5 decades now. Ooh, I just aged myself there a bit. I am a mom of two, so I have a nearly 7-year-old boy and a 3-year-old girl. And I'm a general practitioner. Previously, I was working in surgical specialties and then I retrained to be a general practitioner. My foray into postpartum rehabilitation actually started with my first pregnancy that was in 2017. And I remember it was a bit of a difficult one. I had to be off work for several months because I had some complications. And one of the complications that I had was pelvic girdle pain. And subsequently, I went on to develop pelvic floor dysfunction. It caused me a bunch of problems. And I remember just thinking then, because I, as a medical practitioner, I had a lot of information at my fingertips. So I knew a lot of things, but I still struggled quite a bit. And I think that just sparked my interest, thinking about other people who don't have as much information as I did. How were they coping? What did they know? Did they even know some of the things I already knew? And the more I talked to people, the more I realized that many people just didn't have the necessary information and they were just struggling and plodding along. And it began to occur to me that a lot of women were suffering with complications relating to their postpartum period or their pregnancy period, and they were just struggling with it. And they didn't even realize that was where the problem was coming from. So, of course, I started to work in this area, like you said, educating healthcare professionals, educating women themselves and the community as a whole. Because I know we'll talk about this, I think we'll talk about this a bit more, but it's not just on individuals. I think that as a society, there is a lot we could be doing to support moms. And so that's what my work is all about.
Yeah. And right before we hit record, I was just kind of reflecting on the fact that you are UK based. I'm in the United States. A lot of the conversations that I have kind of reflect, culture in the United States. And I think it's really cool that we can have this conversation on a global level because I think, we can pick apart different healthcare systems in different areas of the world, but knowing that, I think in general, having an understanding of our own bodies and what is to be expected, what should be considered normal, not just common, but normal for our bodies to be doing after birth in that postpartum period and beyond. We need to be educated on that, all women, because if we then know what is to be expected, if we know like what isn't something that we should just be putting up with, we may be better able to advocate for ourselves. And then, like you said, that's also on the healthcare systems and the practitioners to make sure that they also are able to support us in that process. But a lot of it does come down to if we're educated, if we are aware, we have the information, the access to the resources we need to just be able to ask the questions. That's a huge, huge part of it. And so I just am so grateful you're here to have this conversation. What are some of the common challenges that moms face when trying to advocate for themselves during pregnancy and then during the postpartum period? I think I'm just thinking about like my own experience. There's so much information available to us about pregnancy, yet there still is a lack, right? There still are things that it's like, oh, I didn't know that I could ask for this. But the postpartum period, it really feels like you're kind of on your own for the most part.
Yeah. Yeah, there's very much a culture of you've had a baby, now crack on with it.
Yeah.
And it's not ideal, is it? I think that for women to be able to advocate for themselves, and again, I'm gonna emphasize this because I think it's very important. It's not just about the women, because if you think about it, especially the first couple of months postpartum, they're a bit of a blur. You're stuck with establishing feeding, sweating, the postpartum sweat, sleepless nights. It can be a bit of a blur. And sometimes some women don't realize that they are struggling with XYZ until a few months down the line, they look back and see, oh, I was really having a difficult time with this. So I'll tell you an example of myself. I had postpartum depression after my first. I didn't realize until several months later. I looked back and I was like, ooh, this was more than, postpartum blues and all that. So that's why I say society as a whole need to be part of this conversation. So this is where the woman's partner comes in, if she has one, and the woman's family members, friends. We should all support moms because, and again, sometimes as a new mom, especially if it's your first, or even if you're having a different experience second, third time around, you may not realize that this is unusual or abnormal. You may think, especially if it's your first, you may think it's part of the normal postpartum process. So that's why I say the information is very important for every one of us. Now, as a woman or as someone supporting a woman who's just had a baby, don't be afraid to ask questions. Sometimes I think there's very much this culture of you don't want to look like you don't know what you're doing. And I kind of understand that because as a new mom, people seem to forget that you're an adult. They treat you as if you don't have any sense. So it can be a bit challenging sometimes to ask questions because you don't want to further lend credence to that assertion that you don't know what you're doing. But I think it's more important to ask questions if you're not sure of certain things. In the UK, we have what we call health visitors. So in the UK, is very much midwife-led care for the pregnancy, delivery, and the first few weeks postpartum. So we will have a midwife generally going out to visit the woman after she's had the baby. I think they visit like day 1, day 5, day 10, or something like that. And then we have another nurse professional called a health visitor. So they look after children and the moms until the child is about 5 years old. But if you don't reach out to them, so they'll do the routine checks and all that. But if you don't reach out to them with particular questions, then they might not know that you're struggling. So if any questions you have, oh, my vagina feels this way, is that okay? I'm struggling with breastfeeding or my breasts are tender. You can talk to them about these things. I think the most important thing is getting the right knowledge and not being afraid to ask questions. It's better for you to ask a question and you're reassured than for you to struggle along and have a potentially serious problem.
Yeah. I think there's so many factors that can play into why we don't ask the question. I think the way you spoke about just the blur of postpartum too, and how like you're literally in survival mode. Like it's
Yeah.
very much so. And so I think that also though lends so much importance to having these conversations before you're in it, like knowing what to be looking out for, knowing like what your support system can be looking out for too, right? Like when it comes to mental health, physical health, like how can they be prepared to support you through that and kind of keep an eye out and check in.
Yeah,
But really like building that confidence before the fact to say, I can and will ask questions. I will not
yeah,
be timid about doing so because, the saying there's no stupid question. Like when it comes to this insane transformation that we go through, like there is no dumb question. How
no,
would you know what to
absolutely.
expect? Right?
Yeah, and I think it's very important. I like what you said about getting the information ahead of time because, like you said, it's not when you're, surviving basically on 2 hours of sleep. That's not the time you're going to read a textbook or, go to this webinar and all of that. There is a lot of focus in the pregnancy period. This is what pregnancy is like. This is what labor is like. But then after that, we're not really talking about that. So I think it's very important to get the information ahead of time because once the baby is here, you're not going to have the opportunity to do so. So, as part of your preparation for the delivery, you should be preparing for your postpartum recovery and not just looking after the baby, looking after yourself as a woman. Yes, you should be preparing for that before the baby arrives.
Yeah, it's like really prioritizing yourself and what's going to happen with you when the baby becomes this sole focus because they require so much care. We have to do some of that labor of like figuring out for ourselves before that happens. So, in your book, After Birth, Postpartum Recovery of the Body and Mind, you explore recovery beyond the immediate postpartum period, right? What are
Yeah.
some overlooked aspects of postpartum recovery that you see maybe reoccurring?
I think many women do suffer with pelvic floor symptoms, and sometimes women suffer with symptoms relating to their scar, especially if they've had a cesarean section. So, for pelvic floor symptoms, I think the most common presentation is some form of incontinence, urinary incontinence, which is the involuntary leakage of urine. And it can either be stress incontinence, which is when a woman leaks urine at times of increase in the intra-abdominal pressure. For instance, when coughing, jumping, laughing, sneezing. I think many women are familiar with that. Sometimes it can be urge incontinence, which is a sensation of really needing to go. Once you need to go, like you need to go right away. And some women will wet themselves on the way to the toilet. Some women have a mixed type of incontinence, which is both of them occurring at different times. And some women have total incontinence, which is a complete loss of bladder control. That's very rare and usually involves some form of perineal trauma. There are other symptoms relating to the pelvic floor as well, and some people don't tend to realize they are linked. So things like painful sex, problems emptying the bowels, hip pain, back pain, weak core muscles, diastasis recti, they're all linked to pelvic floor dysfunction. And a lot of people, unfortunately, don't realize that this is where the problem is coming from. I also mentioned the problem relating to scar tissue, especially if one has had a cesarean section, can also occur in cases of perineal trauma or an episiotomy. Now, if you think about the muscles, they are enveloped by a membrane called a fascia. And usually, as the scar heals, sometimes it can heal in such a way that you have scar tissue forming, so an excess amount of scar tissue forming. These are in the internal scars, so you can't see them on the outside, but you can sometimes see that the scar is a bit tethered, so it's a bit stuck down, and sometimes that contributes to the C-section shelf, which some women struggle with. That's when a layer of tissue accumulates above the scar. And oftentimes, when that happens, it can cause some aches and pains, especially like back pain, pelvic pain, hip pain. This is because the fascia has become stuck down there in the scar tissue. And as you can imagine, if this fascia is stuck down, the muscle will not be able to move as freely as it should. And that can affect the functioning of the musculoskeletal systems. So you will have some pelvic floor PTs will help with scar tissue release if they can identify that it's contributing to a woman's symptoms.
Wow, I had no idea that a scar could do that, but the way you explain it, it's like that makes sense. If the muscle's not able to like function properly,
Yes.
yeah, like how interconnected it all is. I'm curious because in my mind, it seems like these things are very common, right? I mean, like even just thinking about like peeing when you sneeze, like I think that's like
Yeah,
kind of a joke that that's just what happens, right?
yeah,
And I don't know, and I guess I don't know in the UK how it's handled with like supporting moms in the period to seek that kind of help. But I know, like I said, like I was just at a gynecologist appointment this last week and mentioned something to my uh the practitioner and she's like, "Oh, we'll refer you out. Like it's probably pelvic floor dysfunction. We'll refer you out to a physical therapist." It was really easy. There wasn't a whole lot of conversation we had to have. But I'm like, it took 4 years for me to like think to ask because I didn't even really, I'm like, is this a problem? I don't really know what's going on. And I'm just curious why you think it is that in general the healthcare system isn't like proactively supporting mothers in this way because it's not that complicated like the things to look out for. It doesn't, it's like if you're
no,
having these things, let's have the conversation,
yeah.
but it's not happening necessarily.
Okay, I'm about to get on my soapbox now.
Okay, do it.
So the reasons are complex. I think one of the reasons, and this is why I'm on my soapbox, is because women's health needs have not been prioritized, in the medical systems for a long time. I think women's problems were generally minimized. They weren't given the attention and care that they needed. I think that the medical community has been failing women for a long time. I think part of it is because it was historically a very much male dominated area. And if you think about it, it was only up to a few decades ago that we had hysteria, as a diagnosis. She's just hysterical. And, so that's one of the reasons. I think over the past few decades, as more women have been working in medical fields, having that experiential as well as professional knowledge has helped significantly. Because if you think about male obstetricians, of which most of them were men up until very recently, they might know that, the woman's pelvic floor undergoes all these changes, but because they've never really experienced it, they can't really empathize fully to understand how significant of an impact it can have on a woman's life. I think also that part of it is because when things become common, sometimes they're accepted as normal. Like you said, it's very common for women to have this, and it's PMSL, and I don't go on the trampoline, I have to cross my legs, ha ha ha, hardy ha. No, just because it's common doesn't mean it's normal. And I think it's over the past few decades again that women have begun to realize that, okay, just because this thing happens doesn't mean I have to put up with it. There are still many women who don't realize that they don't have to put up with things like this. So they're not really seeking the help. And also, if you think about it, incontinence underwear. When I was younger, when I used to see the advertisements for incontinence underwear, there were usually women in their 70s. But now you have young women in their 30s sporting this incontinence underwear and they make it look so glamorized, like, oh, look at me, I pee myself, ha ha ha. But I wear this, and I'm just like, no. I think in the UK a few years ago, they had to put a disclaimer on the adverts to say, if you're having this problem, you should see your healthcare professional and all that. But that warning wasn't there before. So it was just kind of accepted as normal. And I think it's in more recent times that people are beginning to understand that, okay, I can have a better quality of life and I can do something about this. In the UK, you asked about the UK experience. So in the UK, we have what we call the postnatal check, is about 6 to 8 weeks postpartum, and is usually carried out by the GP. And the GP has to go through a whole bunch of things relating to the baby and the woman in that appointment. So in that appointment, they'll ask about your feeding, your pelvic floor, mental health, and all of that. I think that just like you said, it's all a blur at that 6 to 8 weeks. And to be fair, most women are still in their very early stages of recovery. So they might not really key into that, oh, this is a problem and this is
Mhm.
a lingering problem. And sometimes in the busyness of life, people just don't pay attention to it anymore. I think if I had my way, there would be another check about maybe 3 months postpartum. And that check would be carried out by a pelvic floor PT because I think someone needs to actually examine you because sometimes problems kind of develop later on. Sometimes people are in the early stages of developing a problem, and if it's identified at that stage, then something can be done to rectify it early enough. So I think if I had my way, every woman would have a postpartum check somewhere around the 3 to 6 month mark with an examination by a women's health physio, and they would, put in some form of plan there. So there's a program called the Mommy MOT. I think it's a kind of a worldwide thing. Do you have it in the US? Yeah.
I don't know, honestly.
So yeah, it's usually carried out by independent women's physio. So this is part of the problem of universal healthcare because it's free at the point of accessing it. We are under a lot of strain, so
Hmm.
we don't have enough healthcare professionals to be able to do this for all women. So those are some of the constraints of universal healthcare. So there's something called the Mommy MOT. It's a private service, so the woman will have to pay for it, and it's basically about an hour long appointment with a women's physio, a pelvic floor PT. They will go through a bunch of questions with her. They will examine her internally if she wants. So they'll do a vaginal examination if she's in agreement. They will examine her core, how she's breathing, how she's moving, and then they can give some exercises to help rehabilitate. And I strongly recommend it for everyone who can afford it because I had it each time after I had my children, and it's definitely worth it.
Yeah, the way that you explained like how things have progressed even in the last few decades, I think is it gives me a little bit of hope because it feels in a lot of ways like how are things so bad in terms of like access to care, being able to afford the care, like you said, like that's a resource that's available that you have to pay for because healthcare systems are under a lot of stress. And it feels so like frustrating that something that is so common and so not normal, so not something we have to put up with, is so kind of ignored. But thinking about it in terms of like where we've come from, the fact that historically, like women were not studied in terms of like health, like this is not a priority for the development of a system that has already developed so much over the last couple hundred years, forgetting about women and that we
Mm,
are making the progress, we are having the conversations. There is a solution. It's just not necessarily accessible, but just the way that like it has progressed so much in such a short amount of time is very hopeful. And I think it's worth calling that out because we don't have to stay stuck in the like this sucks, even though
yeah.
it does.
Yeah, we're definitely making progress, so that's good
Yes.
news.
Yes. And just that I mean, the access is becoming more available. Again, it's not necessarily affordable for everybody. It's not necessarily accessible to everybody, but it is something that like we can start to make this not so much the norm, right? Not so much the
Yeah.
glamorized version of it, like you said, where it's like just
Yeah, yeah,
accepted that,
absolutely. Yeah. And also, one great thing about social media these days is that, you have a lot of like pelvic floor PTs putting out content there. And so even if a woman cannot necessarily afford to have an in-person, in-depth assessment, at least she has some building blocks to start
yeah.
with. And that's great.
Yeah, that's huge because even if it's not a personalized plan of action for you, which obviously is the ideal when we think about like the different factors, it's like at least there is information to use to figure out, and that's accessible to everybody. That's just available, which is I completely agree that that is a huge benefit of social media and something that we all can take advantage of. I'm curious if there's any like practical steps that moms can take to promote pelvic floor healing that you would recommend kind of universally, or if it is something that's more dependent on the situation. I'm just thinking for any mom who maybe like they're in the postpartum period, like what we define as like that, shortly after the baby is born, but maybe years later down the road, like what can we do?
Yeah, so I actually advise everyone, pregnant, postpartum, 70 years old, every woman should get in the habit of doing pelvic floor exercises, I will explain exactly how to do it. The benefits, in addition to making your pregnancy journey a bit easier, in addition to helping one recover well after the baby, there are also other benefits of pelvic floor exercises. Your pelvic floor exercises can improve your sexual experience and improve your orgasm. So, hey, what's not to like? And your pelvic floor exercises can help you deal with the perimenopausal symptoms that occur as well. So, hey, what's not to like? So, to do the pelvic floor exercise, again, I think I'll just explain a little bit more what the pelvic floor is because I just realized we've been saying
Yeah.
pelvic floor, but we haven't really talked about it. So the pelvic floor is a group of muscles that sits, I'll say, in between your legs. So if you think about it like a trampoline, it's just there. And your pelvic organs, so the urinary bladder, the uterus, the bowels, sit on that trampoline. And these organs also exit through that muscle. So it's a group of muscles, and its function is just there to help control. So, for instance, to control your urinary exit and controls the vagina exit and all of that. So that's what the pelvic floor is. Now, to be able to exercise the pelvic floor, it's very important for the muscle to go through its full range of movement because one common problem that some people have is they clench and clench and clench the pelvic floor, but they don't let it relax. So a pelvic floor that is strong has to be able to go through the full range of motion. A pelvic floor that is too lax is not functional. Equally, a pelvic floor that is too tight is not functional and can have similar complications. So, to do pelvic floor exercises, there are a number of ways. I personally think it's easiest to wash your hands, insert your maybe your ring finger or your middle finger into your vagina, and that will give you instant tactile feedback when trying to isolate the pelvic floor muscles, especially if you're not used to doing pelvic floor exercises. Because I think that a lot of people struggle to isolate the muscles because they're specialized and because they're localized in that area. If it's not something that you've thought about before, it might be a bit difficult to isolate those muscles. And you find some people trying to clench their bum or clench their thighs. No, that's not doing a good pelvic floor movement. So, doing a good pelvic floor exercise, you can insert your finger. If you're not keen on doing that, I'll tell you a different way to do it. But I think the easiest way is to insert a finger. You can lie on your back, insert your finger into the vagina, and then think about squeezing that finger with your vaginal muscles. You will feel the contraction in your vaginal area, and you will also feel it around your anus. So it's an inward and upward movement. You're trying to clench the finger with your vaginal muscles, and you should try to exercise both the fast twitch fibers, so contract, relax, contract, relax, and also the slow twitch fibers. So contract and hold for about 5 to 10 seconds and relax for an equal duration of time. If you're feeling squeamish about using your fingers, you can also use a visualization, which is basically trying to imagine that your vagina is a straw and you're sucking up some juice through that straw. So you want to draw it upward and inward, and you will feel your pelvic floor lifting as you do that. And you might even feel a slight contraction in your lower abdominal core muscles because they work in tandem. So you feel that lift around the vagina urethral area and also around the anal area to complete the contraction. So again, remember that the relaxation is equally as important as the contraction. If you still struggle to isolate those muscles, you can try to isolate the muscles using the toilet. So when you're sitting on the toilet having a wee, try to stop your urinary stream with your pelvic floor muscles only. This is only to help you isolate the muscles so that subsequently you can contract them and you know you're doing it right. This is not something that you should do all the time because you don't want to irritate your bladder. You don't want to be interrupting your urine stream all the time. So those are some of the ways you can isolate the pelvic floor muscles. And when you become comfortable doing that, you can do pelvic floor contractions multiple times through the day. I've read about tiny to a Q, so something that happens every so often during the day. So I do my pelvic floor contractions whenever I see a red traffic light. So that's one way. If you're British and you drink tea all the time, you can do your pelvic floor exercises whenever you're having a cuppa. You can choose to do your pelvic floor exercises whenever you're having a meal. You know, it's just something to, to remind you to do it often. When you're starting out, you can do however many you can, but you should try to aim for about 3 sets of 20 contractions in a day. And that just keeps your pelvic floor muscles healthy.
As you're explaining all of that, what's just coming forward for me is how this issue that we're talking about of not focusing on this for women after giving birth really ties into what I would say is like a larger issue that as women, we're usually not taught so much about our bodies, kind of relating back to that, right? It's just not what was important. And so a lot of us have like a disconnect. Like you're saying, you may not even know how to isolate these muscles. You may be uncomfortable with doing these things. And it's just like there's a lot of work to be done in educating us on how to take care of ourselves in these ways and getting comfortable with taking care of our bodies in this way. And it's just like it's important that we're having the conversations. I appreciate how much detail you gave in all of that because I think that's something that all of us, if this is something we deal with, could do. We could start to practice and it's taking action on something that like we deserve to take action on. We deserve to care for ourselves and have functional pelvic floors that, don't leak pee.
Yeah, I know.
It's very important. So I think that's awesome. You do work educating healthcare professionals and influencing policy to improve maternal care. I think that's so admirable. What changes, I know you've shared a few, but like what changes would you most like to see in how healthcare systems are supporting moms?
Ooh, my shopping list.
I know.
I honestly, in as much as I try to influence health policy, I think above all things, I wish we had the village that we used to have. When I was growing up, I grew up in Nigeria and things are a bit different there. And one of the traditional norms in Nigeria is something called omugwo. So when a woman has a baby, her mom or her mother-in-law, basically an older female relative, will come around and stay with her. So they will be there waiting for the baby to be born, and they will look after her for several months after she's had the baby. So she's not allowed to cook, clean, lift, none of that. All she needs to do is sleep, eat, breastfeed her baby. And I wish we had more of that across all societies because a lot of things, honestly, there are a lot of things that sometimes your mom will just say, "Hey, I've noticed XYZ." Because she's had her children, she's probably supported other women when they've had their children. So she knows that this doesn't look right, or, this should probably prompt some more questions. And because the woman is not exhausted all the time, she recovers better. She has more time to look after herself. I think if I could have anything, that would probably be number one, bringing in some sort of support system like that, because I mean, when I was growing up, we had aunties, we had cousins, but very much society these days is very individualistic. You just do everything yourself. And I don't think that's always the best. In terms of healthcare policy, I already talked about what I would wish for every woman to have an individualized recovery plan that would be talked about during the pregnancy itself so that the woman is not catching up after she's had the baby. She already has a plan and it's already in process. Of course, I would want every woman to have a postnatal check by a women's physio, like I said earlier. I wish that during the delivery process, I wish that every woman could have maybe a little more time in hospital if needed. Because if you think about it, our moms, when they had their babies, if they had a vaginal delivery, they would be in hospital for 5 days. And that's for them to recover. That's for them to establish breastfeeding. That's for them to ask questions of the nurses and other healthcare professionals, see a lactation consultant before they went home. And if they had a C-section, they could be in hospital for 2 weeks. We don't have that anymore. Um, Part of it I understand because the longer one is in hospital, the more at risk one is of having a hospital acquired infection. So I understand that to an extent, but I think the main reason is about money because they need that bed, they need to move people out. And so you have a lot of women having their baby, and then 4 hours later, they're on their own, they don't know what to do. I was in hospital after my first. So I had my first in a high risk unit. I had my second in a home birth. After my first, I was in hospital for, I think, 4 or 5 days after the baby itself. And by the time I got home, I still hadn't established breastfeeding. I was already sleep deprived because it was a busy ward. So it was in the postnatal ward. I think we had 4 people in my bay. And yes. So if my baby wasn't crying, somebody else's baby was crying, and somebody was coming to check somebody's blood pressure. So by the time I got home, I hadn't slept for a week straight. So and I hadn't established breastfeeding. So it was I felt like I was starting on the back foot. So if I had my way, obviously all those things would be addressed. If I had my way, every woman would be seen by a lactation consultant if she needed it. Because I think that a lot of women, especially with the first time, a lot of women struggle to establish breastfeeding. And for many women, they just give up. So yeah, there would be so many things I would do if I had my way. If I had my way, every woman would have at least 6 months maternity leave fully paid, and her partner as well, at least 3 months. Because so in the UK, we have it good in terms of everyone is entitled to 12 months of maternity leave. It's not usually paid, but at least you can take the 12 months if you want. But then your partner will get 2 weeks of statutory paternity leave, and then he goes back to work and you're just on your own struggling with the baby. So yeah, if I had my way, I would fix that.
Yeah, so much in what you said is really about creating that like time and space and opportunity for energy because the mom's rested to actually like deal with the things that so often are just not dealt with. Like there's just not the time. We don't have the energy. We don't have the support to do it. So I think like just going back to the first thing you said about having the village and like being able to rely on other people to provide care for you and to give yourself the space to like be rested enough to think like what is it that my body needs? What's off here? Like how huge that alone is. And while that's such a big, like lofty, we're probably not going to change individualistic cultures to be so completely supported in that way. There are things that we can do in our own lives to get that support for ourselves and also act as that support for other people. And I think, again, like finding any angle of empowerment in these conversations is important because we're talking about like big systemic issues that can feel really crummy. So it's important to like know like we can tap into that. We can tap into being that support for others and advocating for
Yeah.
that support for ourselves.
Yeah, absolutely. So when I had my second, especially, like I said, it was a home birth, and one of my friends said, "Oh, I can take your first, my son." And she was backup in case I needed to go into hospital for whatever reason. But
Mhm.
thankfully, I didn't have to go into hospital. I had my planned home birth. But then 2 days later, she said, "Oh, I can have your son, so that you can have some space to rest and I was like, "Oh yeah, fine." And she took my son the whole day, and he played with her sons, and it was great. One of my friends came to visit. She didn't even come in the house. She said, "I just came here to give you some food," and then she went, and that was great. So I had a lot of support in that way. and it was fantastic. So we can be that for other people when they have their babies, you know? So because I think especially the way the world is now, people move away from I've moved away from, my birth country. I'm in the UK now. And we have a lot of that going on. So the friends now become the village
Hmm.
if they're willing. My neighbor, my next door neighbor as well, she was great. She came to see me, gave me some food. She was also willing to take my son if I had to go into a hospital for any reason. So we can be the village for our friends and family.
Yeah, that's a beautiful sentiment to kind of wrap things up on. Before we close out the conversation completely, I really enjoy asking guests about self-care and how you care for yourself because I think as moms, so often we forget to care for ourselves or it feels
Yeah.
like selfish or whatever it is. But caring for ourselves, making sure our needs are met is like crucial. And I really think talking about what that looks like in reality is important. So I'd love to just ask you how you take care of yourself and any advice you have for moms to make sure that they are also getting their needs met.
My idea of self-care, I think for me, at the heart of it is doing something that nourishes me as an individual, not as a doctor, not as a mom, not as a wife, just me as Phoebe. I like to exercise. I'm very fortunate that I enjoy exercising. So I exercise pretty much every day. I am very fortunate that I am naturally an early riser. So I wake up at about half five, five, sometimes six. And for me, once I just wake up, house quiet, I'm the only one awake. That's my special time. So I wake up, I do my exercise. I'm a Christian, I pray. So once I've exercised and prayed before I start my day, I just feel like I can conquer the world. I also have a few hobbies. I like to read a good book. I like to crochet. I like to dance. So sometimes I'll just have a little dance party just for 5 minutes. That nourishes me. I also like to try new things and I like to say yes to things. So last week I was in Antalya, Turkey. I went for my friend's birthday party, 40th birthday party. And she was like, "Oh, can you come? Can you come?" I asked my husband, "Can you watch the kids? Because I am gonna say yes to this." And he was like, "Yeah, fine." And that's great. And I think I'm very fortunate that, for the husband that I have, because so if I've encountered this because I started traveling and doing things without my kids when I could quite early on. And if I go somewhere without my kids, everybody's like, "Oh, where are your children? Oh." But when my husband travels, nobody asks him, where are the children? So it's important to me to hold on to my own personal identity and not just get lost. I think I did get lost in the first few years. I lost my sense of self. For a while, I was just mom. I think I'm just now starting to reclaim that identity. And I would advise every woman, like, if you're struggling in the first few years, if you have really small children, it can be difficult. So now I just told you that, I wake up at five, six, I exercise, I do this, I blah, blah, blah. 1.5 years ago, I couldn't do that because of the season that I was in. So if you're a mom with small children and, you can't do all of these things yet, don't stress too much about it. Your time will come. They will eventually sleep through the night. They will eventually not need you to rock them to sleep, and all of that. So you will reclaim some of yourself as time goes on. Don't stress too much about it, but at the same time, don't get completely lost either.
Yeah, I think all of that is really important. And just going back to like knowing that we are allowed to care for ourselves, we're worthy of caring for ourselves. If that means traveling without your kids, if that means waking up early to give yourself that time and space, if that means having a dance party, like whatever it is, like you are worthy of doing the things that fulfill you and fill your cup.
Absolutely.
Where can listeners find you, connect with you, learn more about the work you're doing?
My website, www.phoebeajayi.com. I'm on LinkedIn, Dr. Phoebe Ajayi, Instagram, and you can find my book on Amazon as well. After Birth, Postpartum Recovery of the Body and Mind is also available in Barnes and Noble and any major book distributor worldwide.
Amazing. I will make sure all of it is linked as well because it makes it nice and easy for listeners to find you. Thank you so much for being here. I know with the time difference, it's getting a little bit late for you. So I really, really appreciate you taking the time to have this crucial conversation with us.
Absolutely, my pleasure. Thank you so much for having me. I really do
Yes.
not take it for granted. Thank
Oh,
you.
thank you. And thank you to you tuning in. This is important stuff. See you next week. You are worthy, Mama.